Hello, I am Dr. Gemunu Hewawitharana, a pediatric neurologist. This presentation is based on our recent publication in the Developmental Medicine and Child Neurology Journal. We introduce a reliable, easy, and practical method to detect cerebral palsy and other developmental delays in high-risk newborn. Our method combines two general movement assessments and one Hammersmith infant neurological examination to achieve this, particularly in resource-limited settings. Why is this important? Early detection of cerebral palsy and other developmental delay is crucial. The earlier these issues are identified, the sooner targeted therapies can begin, significantly improving outcome for children. In high-income countries, early detection depends on advanced imaging like MRI combined with general movement assessment or Hammersmith infant neurological assessments. However, in low and middle income countries like Sri Lanka, access to MRI and specialized care is limited due to cost, distance, and shortage of specialties. This makes early detection a huge challenge. A decade ago, the Pediatric Neurology Unit at Teaching Hospital Karapitiya in Sri Lanka introduced a modified approach which include a writhing movement assessed before hospital discharge and one fidgety movement assessed at 3 to 4 months of corrected age. Finally, hind assessment done at around 5 to 6 months of corrected age. This method is practical, cost-effective, and feasible. We conducted a prospective longitudinal study at the Pediatric Neurology Unit, Teaching Hospital Karapitiya in Sri Lanka, following 201 high-risk newborn who underwent this modified assessment, including two general movement assessment and one Hammersmith neurological examination. Teaching Hospital Karapitiya is third largest tertiary care hospital in Sri Lanka with over 2,000 beds and maternity service facilitating over 1,000 births per month. The hospital serves a population of 2.6 million in the southern Sri Lanka. Writhing movements were recorded before hospital discharge prior to 44 weeks of gestation, and fidgety movements were recorded at 3 to 4 months of corrected age by trained therapists using Practal standardized protocol. This ensured consistency and quality in the video recording. This general movement video were assessed independently by Practal certified evaluators with high inter-rater agreement, blind to other clinical details. Writhing movements were categorized as normal or abnormal, helping us identify potential neurodevelopmental issues early. Similarly, we categorize fidgety movements as normal and abnormal. The Hammersmith infant assessment performed at 5 to 6 months of corrected age provided a global score that further enhanced the predictivity of cerebral palsy. Our study had two primary outcome measures. The first outcome measure, cerebral palsy, diagnosed at age of 2 years corrected age independently by two pediatric neurologists. Second outcome measure was developmental outcome in non-cerebral palsy group, including cognitive, motor, social emotional, and speech and language. assessed using Bailey scales of infant and toddler development 4th edition by Bailey certified assessor after 2 years of age. Coming to the results, among the 201 children, most were born by emergency cesarean section. The commonest risk factor was low birth weight related to prematurity. Also, the birth asphyxia and perinatal infections also contributing as a significant risk factors. Among 201 sample, 10% of children were diagnosed with cerebral palsy. Out of these, over 75% had severe motor disabilities, and spastic quadriplegia being the most common subtype of cerebral palsy. This differs from data high-income countries, probably due to the variation of risk factors and early intervention and early management strategies difference. Then when talking about the cerebral palsy predictive accuracy, when all these three assessments, including 2 general movements and 1 hind, were combined, the sensitivity for predicting cerebral palsy was 100%. This means no cases of cerebral palsy were missed. This combined approach is groundbreaking in resource limited. Our modified method also accurately predicted motor, cognitive, and social emotional delays in non-cerebral palsy children, addressing a gap in existing data. This comprehensive approach can help identify developmental delays early for timely intervention. In conclusion, our modified approach represents a significant advancement in the early prediction of developmental outcomes for high-risk newborn, particularly in resource-limited settings. This method enables accurate identification of developmental issues before 6 months of age with an exceptional 100% sensitivity for cerebral palsy and reasonable predictivity for non-cerebral palsy developmental delays, including cognitive and social emotional delays. For families and caregivers, this method offers a reliable prognosis, enabling timely and targeted intervention that improves children's quality of life, support their optimal development, and reduce the long-term burden on caregivers. These findings carry significant global implications. By integrating cost-effective tools like general movement assessments and Hammersmith neurological examination into routine clinical checkup, healthcare system in low and middle income countries can revolutionize early intervention practices. This study highlights that innovation goes beyond advanced technology. This approach demonstrates how simple, practical solutions can create transformative change in resource-limited settings, ensuring early detection and intervention are accessible for all. Thank you for your attention. I invite you to access our full research paper, which is open access and freely available in Developmental Medicine and Child Neurology. Let's work together to improve early detection and intervention for high-risk children worldwide. Thank you very much.